Hello, my name is Catheter and I will be doing the insertion of Foley catheter video, and I'm wearing my Nightingale scrubs and badge, and then I have my supplies with me. I will knock on the door and enter the room, close the door behind me for privacy, perform hand hygiene. Hi, my name is Catheter and I'm going to be your nurse today. Can you verify your name and date of birth? Thank you. The doctor has ordered the placement of a Foley catheter, which is a tube that's going to sit in your bladder and continuously drain urine. Does that sound okay with you? Alright, so I'm gonna put on some clean gloves and clean the patient's perineal area with no rinse soap and by using a towel. Can you please bend your knees and lay them open and your feet apart? Thank you. So we're going to wash anterior to posterior and afterwards dry them using a dry towel. Okay, so I'm going to check the patient's urinary meatus, see if I can see that opening, and also check for any discharge, discoloration, or any odor. Okay, I'm going to remove my gloves. Okay, perform hand hygiene. And I'm going to put the bed at a comfortable working height. And I'm going to prepare the sterile supplies now and place it between the patient's legs. Okay, now I'm going to open the sterile field carefully, one flap at a time. Okay, making sure I don't touch anything inside the sterile field. Okay, I'm going to put on sterile gloves now. Pull out my drape. Okay, will you lift your hips up and we'll put the drape under you. My drape's a little wet from earlier. Okay, we're going to put the drape over. Okay, I'm gonna pull out my alcohol swabs and place them in easy reach. I'm going to pretend to open the lubricant. Okay, I'm gonna pull out our Foley and lube the tip. Okay, and then attach the syringe. Make sure we have a 10 cc syringe with fluid. Okay, I'll clean the area using alcohol swabs, starting from away from me, then towards me, and then finally down the center. Okay, and then place use swabs in the trash. Grasp catheter 2 to 3 inches from tip. And then insert as patient exhales, and then advancing until urine flows. Okay, now I'm going to insert the catheter, and please take a deep breath, and on the exhale we're going to insert it. Okay, I'll advance the catheter another 2 inches after seeing urine. Okay, now I'm going to inflate the balloon to secure the catheter in place. Okay, now I'll pull gently on the catheter until I feel resistance. Okay, I'll clean the perineal area using the sterile drape. Okay, perform perineal hygiene. Okay, and then I'll dispose of the used supplies and secure the catheter in the patient's leg. Okay, and then I'll hang the catheter bag below the bed. I'm going to remove my gloves and perform hand hygiene And then, are you comfortable? Okay, so I'm gonna cover the patient back up. And then please use the call light if you need anything. Make sure not to pull through the slack so it doesn't move around. Let me know if you feel any discomfort. Do you have any questions? Okay, perfect. So now I'm gonna document the procedure.